Got it. This, I'm just going to go through, I'll just go through the slides that I have here in order, and then maybe you can move them forward. Is that possible? So are you looking at the side that says objectives?
Yes,
Okay.
we're good.
Okay, so sorry about that, everybody. So the objectives for today are to talk about hoarding disorder and to give a definition. We'll identify causes. We'll differentiate between hoarding and collecting, and we'll do an assessment of. We'll talk about assessments for hoarding disorder, and we'll look at interventions and treatment for hoarding disorder. Hoarding disorder has to do with a persistent difficulty of discarding and parting with possessions, regardless of their actual value. The difficulty is perceived need to save the items and distress associated with discarding them. Hoarding behavior results in the accumulation of possessions that clutter the active living areas of the home, and in some cases impact safety. And finally, that hoarding causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. Folks with hoarding disorder sometimes just have trouble getting to work on time. They have issues with socializing with friends and family, and they have economic hardships due to their need for cleaning up their home and the cost of that, which is substantial. Signs of hoarding include blocked and cluttered exits, impaired pathways. When we go to a hoarded home and it's piled about 5 or 6 feet high with clutter, we call these goat paths that sort of snake their way through the home. Folks with hoarding lose important items in the clutter. They often have duplicate items. They're going to work on the garage this weekend and use a hammer and they can't find it. So they go out and buy another one. And in fact, they might have 15 hammers in their house. And in significant cases, there's rodent and insect infestation and rotting food or used food containers in the home. Next slide. Hoarding occurs in about 1 in 20 in the general population. This has been nationally studied before. And it cuts across all socioeconomic statuses, educations, and cultures. And about 80% of animal hoarders, which is a subset of hoarding disorder, also hoard objects. The disorder is grossly undertreated. It's underreported because of the stigma and the shame. And there's a lack of trained mental health professionals. I'm not aware of any professional school that specifically addresses working with folks with hoarding disorder. And the cleanup costs can be very expensive. If a person has hoarding disorder and wants to get treatment and is willing to clean out their home, it could take up to 2 years to actually get the home to a condition where it's just safe enough, and it could cost tens of thousands of dollars. That's because when we're going with a hoarder through their home, they have to select one item at a time usually. They have a hard time sort of multitasking and they have a hard time making decisions. Hoarders have impaired cognitive processes. We know that they have issues with attention deficit. About 20% of people with hoarding disorder have ADHD, and they have a lack of focus. We know that there's issues with memory and recall, and they have impaired categorization of items. So a lot of the executive functions are sort of abnormal in folks with hoarding disorder, and their decision-making is slowed by perfectionism. There are psychological contributors to hoarding. This includes the comorbidities. About 40% of people with hoarding disorder have either depression or anxiety, or both. And again, about 20% have ADHD. There's a loss of executive function from trauma. So lots of folks with hoarding disorder have had trauma in their life, either a death of a loved one or being in a car accident or having a physical injury. And that any of those traumas seem to trigger hoarding in folks that are sort of predisposed to it. And hoarders often have cognitive distortions. They may say things like, why bother? I'll never make progress, or it's really not that bad. They might minimize. As I just mentioned, that a lot of hoarders have trauma. The hoarding sufferers report a greater frequency and a greater number of the types of traumatic events than control groups. And there's a correlation between the number of childhood traumatic events and the severity of hoarding in adulthood. And there's social contributors to hoarding. These are things like environmental trauma that we just mentioned. If there's some kind of trauma that the person's experienced, learned behavior. If a person has grown up in a hoarded home, they're more likely to become hoarders in adulthood. And we live in a culture where we're always encouraged to purchase things, and there's excessive purchasing. And hoarders are very susceptible to things like buy one, get one free. If there's one item that they need, but it's on sale for $5, then they tend to buy 5 of them. And as just mentioned, we're encouraged to purchase all kinds of things in our society. Amazon has not been good for people with hoarding disorder, that they can stay at home and continue to add to their stuff at home without leaving the house. There's differences between collecting and hoarding. Collecting tends to be goal-oriented, and people budget their time and their money. Collectors like to keep their things in a safe location, and they're aware of damage. And then they show pride in their collection. They like to show it off. Hoarders, by contrast, are impulsive and unplanned in terms of collecting items. Their possessions tend to be missing in action as objects sort of get lost under the clutter. And they have a lot of embarrassment and shame when it comes to the condition of their home. Next slide. So when we do assessments for folks with hoarding disorder, we want to look at things like safety for all. That would include residents of the home as well as visitors and pets in the home. And when hoarders, when their treasures start to reach out into the yard, then we need to pay attention to the condition that the issue with neighbors getting stuck in the hoard. We have to look at their insight that they have into their situation and whether they have anosognosia. We also assess for stages of change. Many hoarders are sort of stuck in the pre-contemplative stage or the contemplative stage, and they're not quite ready for treatment, but they're thinking about it. This is just an assortment of some of the assessment tools that we use for people with hoarding disorder. Next slide. This is one of the assessment tools we use. It's called the Clutter Image Rating Scale. And this can be used for somebody who's in the home. It might be a nurse. It might be a home health aide. That helps us to get a better picture of the condition of the home. And you'll see there's a series of slides here. Next slide. Going from a less severe case of hoarding to, or not hoarding at all, to cases of hoarding. And then next slide. And then severe cases of hoarding where you can't see the floor and things are piled up. Next slide. Another tool that we can use is the hoarding rating scale. And it just asks a simple question. Because of the clutter or number of possessions you have in your home, how difficult is it for you to use the rooms in your home? And the hoarder will answer, along this continuum, it's often that they will minimize. So if a person scores a 5 or 6 on the self-assessment tool, then it's likely that they may be in the 8 or 9 range. Next slide. Regardless of which method of treatment we use, we want to have general goals for clients. We want to improve their decision-making abilities because that's kind of key to hoarding disorder. We want to increase their distress tolerance. We want to increase and establish living space and increase the appropriate use of their living space. Next. Here's a list of some of the interventions and tools that we use with hoarding disorder. And regardless of the tool we use, what we're looking at is harm reduction in the home. That's kind of the key thing. Next. We want to have a harm reduction approach regardless of which method of treatment that we choose. It's not necessary to completely clear out the home. That we're not going to get houses that go from hoarded to House Beautiful magazine. What we do is we want to work on things like working smoke detectors and clear hallways. We want to make sure that the appliances are working, and we want to take care of garbage and waste in the home. Those are sort of the priorities. Cognitive behavioral therapy can be very helpful for people with hoarding disorder. There's one model that's set up where a clinician will go about 26 sessions with the folks with hoarding disorder. And what they'll do is they'll do some of those sessions in the clinician's office and some of those sessions at home. Motivational interviewing is something that if anybody's working with folks with hoarding disorder, I would recommend that everybody have training in this, that it helps the client connect to their values, their goals, and their behavior. And it helps them to start to have more confidence in their own ability to change. And we can use exposure techniques for folks with hoarding disorder. What we would do is these little experiments where we would take a person with HD to a grocery store or to a department store and give them 5 minutes in the store without purchasing anything. Then they would come out and we would sort of debrief with them and work with any anxiety the person has, and then send them back in and try it for 7 minutes without purchasing. And we would move on like that. A Buried in Treasures treatment group is a very helpful guide. That's a peer facilitated program guide for folks with hoarding disorder. They get together in groups of about 10 to 12 and go over each of the sessions that's in the book. And they don't need a professional facilitator for this, so it's cost effective for communities. There's not a specific medication that directly addresses hoarding disorder, but what some clinicians will do would be to prescribe for anxiety or depression, and with the hope that once the mood is lifted, that the person is more likely to focus and more likely to move on with change. And this is a list of things for anybody helping the folks with hoarding disorder, anybody helping in the home. Do not sneak things out of the home ever. It's very tempting to do this when you're in a hoarded home and trying to help them clean up. Do not argue with the person. Ask permission to touch or to move any possession that's in the home. And to remember to learn the client's rules and to honor them. And to show empathy. This really is not about stuff. It's about the identity of the person with hoarding disorder, that they emotionally attach to their items very strongly. And here's some resources that we have. And that concludes my presentation.